Business School for Today, I'm going to be presenting to you our Global Healthcare Management with Roots and talking to you about this program. And hopefully at the end, you'll have plenty of questions. And again, you can put those questions in the chat at any time. So just to get started, I'm going to tell you a little bit about the Global Business School for Health. We're the first business school totally dedicated to educating really the next generation of health and healthcare managers and leaders. We're located on UCL East, and I'll talk more about our campus. But I want to talk to you about just the school in general. So the school has a number of postgraduate programs that span a number of different specialized areas: biotech and pharmaceutical management, digital health, and of course, this global healthcare management program that I'm going to speak about today. We also have an MBA in health, an executive MBA in health, and a doctorates in business administration health. So everything we do in the school is around health and healthcare. And why is that so important? Well, because we're living in a new period. We're living in what's been termed the new health economy. More and more of our GDP, our economies will be, will really be piloted, and the center of growth will be around healthcare. So if we think about the period of COVID and even before that, we see that more people are seeking healthcare. The expectation of societies is greater for the healthcare provision than we've ever seen before. And post-COVID, we've seen the acceleration of particularly digital health, the stakeholders in healthcare, and it goes into business. We see Google is in healthcare, Amazon is in healthcare. So healthcare is changing at a very rapid rate. So the kinds of people that we need in the healthcare sector, particularly in terms of managers, leaders, the kind of thought leaders, are people then who have an interdisciplinary background, who can think from a business perspective, not just from a public health perspective, and bring that into looking at public-private partnerships, widening the kind of way in which we approach health and healthcare to really galvanize a new economy. So if we think about places like the United States today, they spend 18% of their GDP on healthcare. And other countries, European countries, spend upwards to 10 to 12%. So it is a very important sector. And then if we look at the labor force, for example, here in the UK, the NHS is the 5th largest employer in the world. So it really helps to see just how health and healthcare are playing a bigger part. The other thing is, with climate change, aging populations, lifestyle changes, where we see more non-communicable diseases such as cardiovascular disease, strokes, diabetes, all of these things require treatment. So the other areas in which we're really focused on is, how can we bring things to market quicker? How will our health systems change? And also thinking about diagnostics and preventative medicine. So many health systems around the world now are investing more in early detection, helping to get people to change their lifestyles. And of course, mental health is also a major aspect of what we're seeing in the changes in this space. So at the Global Business School for Health, we've got a very interdisciplinary faculty made up of people from, who are health systems experts, to people who are like myself. I'm a professor of leadership and management for healthcare. And other colleagues who've got that combination of business and management, but with that healthcare lens. And then we have engineers, We have AI experts. We have a physicist who looks at complex adaptive systems, because healthcare is a complex system. And our actions have all sorts of intended and unintended consequences. So being in an interdisciplinary faculty and department is really exciting. It's going to give you an opportunity to take what you've learned in probably a very siloed first degree, where you studied mainly one subject, and really move that to the next level, to think much more interdisciplinary. And that's exciting. It's exciting for you as a student, and it's exciting for us as the individuals who will be teaching you and supporting you through this journey. So it may be a bit uncomfortable at first when you start to think about health and healthcare from lots of different lenses, and to see how an interdisciplinary approach, where you're thinking from lots of different perspectives rather than just a siloed small approach. And this is important because what we try to do at the Global Business School for Health is really focus on the problem, not on whether or not it needs to be sitting over in a medical school or a pharmaceutical school, or do we need the life sciences? We look at the problem, and then we think about what is the group that we need to curate to bring together. So part of your training at the Global Business School for Health is doing teamwork and working in interdisciplinary teams amongst yourselves, so that you also learn how to collaborate and think and use the expertise of other people, because that is how the real world works. You know, all of these problems that we're trying to address, they cannot be addressed by one discipline. So when you go out into the workplace, you've got to be a great team player. You've got to be able to understand how to leverage your colleagues and those around you to find the solutions and answers that you need to many of these pressing issues that we face today. So the Global Business School for Health is a great place then for you to really start to mix with lots of different people. Some people from health backgrounds, some from healthcare backgrounds, some with clinical backgrounds, some with non-clinical backgrounds, people with business backgrounds, and to see how you can work and leverage those different areas. So we do that then in this program, which brings people together from business studies, whether that's finance, accounting, HR, marketing, management, to as well as people from, different clinical backgrounds and also health backgrounds, to think collectively about some of these big issues and to garnish those skills that you need, those critical business and management skills to address these problems. So in this program, you take two sets of modules, as it were. You'll take some that are very much focused on your specialism, and some that will be much more focused on kind of core competencies that we believe through our research and our engagement with employers are critical skills for anyone thinking about doing healthcare management. So the idea is to get you to understand that kind of contemporary healthcare landscape. And so you'll get leadership and management skills. You'll also have the opportunity to learn theories and principles and practices around healthcare. And then you'll also, particularly in term 2, when you take changing health systems, you'll get that global lens and think much more on the systemic level. So the program offers you opportunities to see things at the micro level, at the organizational level, to think about your practices as a manager and think about some of those functional areas. Then it also gives you those wider kind of competency skills that are at the macro level, where you think much more systemically and at the industry level. Then within that, you also get the opportunities then to have what we call a route. So why is that? Well, because when we went out and did our initial survey and research with employers in various health organizations, we asked them a really important question. We asked them, what are the things, the competencies that you'd really want in your staff? And one of those was, of course, finance, because finance is so important. The second one is really understanding data, those analytic skills. And the third one, of course, was leaders. All of this requires brave, courageous leaders, people who can take these ideas, the changes, drive change management, which is so important. It's not just about innovation, but you can have innovation, but if you don't have the leaders that can actually drive that innovation forward, it isn't going to be very useful. So what kinds of background then do you need to succeed in this program? So in terms of the requirements, we ask that all the students have at least a 2.1. And that's really the minimum. So you need a 2.1 to apply and actually get into this program. If you have extensive relevant work experience that you can demonstrate in your CV, we will take that into consideration as well. Then in terms of the language requirement, you need a 6.5 or above overall, and you cannot have less than a 6 in all the sub areas. And usually students take IELTS. There are other language tests you can take, and you can see and find those on the UCL website. Then, of course, you need a personal statement. And for students that haven't studied any health before, that's a really important part of your admissions process. We need to see and understand why you want to pivot into health or healthcare and your commitment to healthcare management. And then, of course, you need a reference. And again, that reference, make sure the person you select to give you your reference is someone who can really write up on your behalf and knows and understands the program that you're going to do. Now, who is this program for? As I've just articulated, we're a very interdisciplinary staff. We take a very interdisciplinary approach. Consequently, we're quite open on these programs, what the background of the students are. But we are looking for students who are really enthusiastic. You're going to be expected to work on cases and simulations, work on teams. So you need to be a person who's interested and excited about engaging. Who wants to be a change maker, who wants to develop and share opinions. So really being someone who is excited and want to be engaged in this process is very important. So we're less concerned whether you're a new graduate or you've been out and you've worked for many years in either business or health or science. But we are really, concerned and interested to make sure that this is the right program for you and that you're excited about making a difference in healthcare. And that can be also demonstrated through internships you might have done, relevant works you've done. So many ways in which you can demonstrate that through your personal statement and your CV. Now, what is the actual structure of the program? Well, it starts out with a 1-week induction, and that is really focused on helping you get a sense of belonging, understand the expectations, get to know the school. So you'll be also given access to a course on global health. It's a very short course, but the idea there is to help you to understand the healthcare space before you start the program, particularly if you're coming from a non-health background. We also have other primers. So if you're coming from a health background and you don't know much about business, you can take a primer on accounting, finance, and economics. And then when you start your actual program, the first semester is really focused on giving you a background in health economics, which again is very integral. It's different than just regular economics. And the idea is to understand how health economics and health and finance, which are integral to any health system. And actually, is a major reason health systems vary, to understand that context. And then, of course, leadership and management, which is a key aspect of this program as a healthcare management program. Then alongside of that, excuse me, you'll take 2 courses in your routes. So for example, if you're doing the leadership route, you take strategic healthcare leadership, which is a course that I teach. Again, it teaches you about strategic leadership and a lot about strategic management. We do a simulation in that course called Healthcare Heroes, where you work in a team with your colleagues running a hospital, and it gives you an opportunity to see how your strategy that you come up with aligns to the actual finances and deliverables within that organization. It's a great opportunity to really use simulation. We also use cases, which are very important, to case studies where you get the opportunity to see the decision-making of a protagonist and to understand how that works. We use role plays also in our courses, point, counterpoint. Of course, discussion is key. So we use also what we call a flipped classroom. We try to put as much material online for you so that you can prepare before you come to class, so that we can make the classes more interactive, an opportunity for you to gain a voice, think really critically with your colleagues, do activities when you're in seminar. And then if you're on the finance route, you take risk management. It's very much around healthcare, but it has a focus on quantitative financial risk. And then you also have accounting and finance for healthcare. And again, you get the opportunity to do a number of case studies that help you really hone in and understand how to apply accounting and financial skills to healthcare. Then the third one is analytics. And we teach our analytics program with the Institute of Health Informatics. You'll take a couple modules there. We're also going to be adding some options for the analytic route in the coming year, so students can, who have more background in, say, computer science or similar area, or already study business analytics, can take more advanced courses, as well as the courses that are more introductory. So they're a world-leading department, the Institute of Health Informatics. So it's a great opportunity to get to study at the Business School for Health, but also get to study at the Institute of Health Informatics. Then in the second term, it runs very similar. You'll take two core modules. The two core modules for term 2 are changing health systems. As I said, it gives you a real great macro view of what healthcare looks like. And you also take a more functional course in organizational behavior and human resources. And again, with the idea of really honing your skills, your management skills. And then if you're on the leadership route, you get mentoring and coaching, which is a very coveted skill nowadays in the healthcare space, as well as leading innovation and change management. That is taught by a world leader who has done so much, has a number of TED Talks, who is really at the cutting edge of digital health as well. And then if you're on the finance route, you get capital and private equity markets, which again is very important if you're interested in investment. And then you'll also get another kind of health economics course with a value-based approach. So really comprehensive. And then again, those students doing the analytic route will get the modules with the Institute of Health Informatics. So really quality number of courses that you can take, lots of variety to choose from as you select your specialism. The other thing is you're going to do 2 projects in term 3, and they're really exciting. One is a business project, and all of our students, so not just our global healthcare management students, but our biotech and pharmaceutical students and our digital health and entrepreneur students, all take this business project where they develop an idea for a healthcare improvement. And it's really from concept to business case. So you're going to write a business case, and you'll also do a pitch, and you'll work in a group. So again, you'll get to hone your team building skills. That module we started in term 1. So in term 1, you'll be asked to attend a number of workshops to help you start to formulate your ideas, understand how to take an idea from concept to actually putting together that business case and that pitch. And then in term 3, You'll finish it off with your group, and you'll have the opportunity then to submit your business case, and then you'll also do your pitch. There's also a research project, which is also equally important. It's an opportunity for you to do a research project. It's desk-based, and what do we mean by that? So we're not looking for you to do primary research, but you can use secondary data and other kinds of research approaches. Some students did systematic reviews, others used data and material that's out there. But it's an opportunity for you to select a topic that you're really passionate about and to work with a supervisor to write up a paper. And so in term 2, you'll also get some workshops to help you with your research project, your research journey, and then you'll be assigned a research supervisor. And I have to say, I myself supervised a number of students, and one of them went on now to do a PhD in the area of finance. But I've had one recently contact me about publishing their research outcomes, their paper, their manuscripts. So, and some fantastic projects. A really impressive group of students last year who did some real wonderful work. So this is a good overview of the program. It gives you an opportunity to meet lots of different kinds of academics. Again, back to the theme of our interdisciplinarity, some world leaders, people who are really making a difference in health and healthcare, as well as get lots of different kinds of ways in which you're assessed. So we use a real wide range of assessments. And we try to build in as much interaction, because the workforce that you're going to go out and work in really requires teamwork. It requires project-based work. So getting those kind of project management skills and working with your colleagues is a very important part of your learning at the Global Business School for Health. Now, often we have students who will ask about funding, and of course, I recognize that coming to the UK and doing a degree can be very expensive. We have in our department a number of scholarships that you can apply to. These are 2 of them. And we're constantly looking at ways to raise money to get more scholarships. And we'll put those, of course, on our website. So we have a Women's Healthcare Leadership Scholarship, and we have a Global Healthcare Leaders Scholarship. So whether you're a home student or an overseas student, you can apply for these scholarships, and they will go towards reducing your tuition. There are also other scholarships at UCL. There's master's bursaries. There's also, if you're coming from the United States, you can apply for a US federal funding and get a loan. UK has loans as well. There's also the Chevenings, which we have a number of students who have that, Commonwealth scholarships, Fulbright, great. And UCL has actually, if you Google UCL Scholarship Finder, you can look and see if there are other scholarships you might be eligible for at UCL. Also, if you're coming from a country where you may approach your Ministry of Health and see if they would fund you, or if they've got scholarships that you can apply to as well, because many countries recognize the need to train health professionals in business and management. So how about your career? So we see these master's programs, and particularly this program, as very much a professional program. So we're really focused from the very beginning on helping you with your career journey. And even after you graduate, if you're still looking for a job and you need support, you can come to us. We've got a careers person for our master's program. She's available. She does lots of one-on-ones. We also run 2 career festivals a year for our students, where we try to give them advice and get them thinking very early on about their journey and applying for jobs. Many of our students do part-time jobs while they're also undertaking their degrees. So we really focus and work with UCL Career Services. We also work with Innovation and Enterprise. We have a number of students who have graduated now and are starting businesses. A few of them have got spaces at UCL in what UCL's incubator is called the Hatchery. And other ones have places at other organizations in London. And of course, having gone to UCL, you're joining a huge community of alumni and a very rich alumni network of individuals who can help you and work with you as you go forward. We also have what we call our health execs in residence, who are people who come from industry, various areas in healthcare, who support us. And they also mentor our students. They give lectures. We've got career coaches. And then when you're doing your project, that business project, you'll also have the opportunity to talk with industry mentors as well. So we have, last year, we had over 100 people from industry come in, either to speak as guest lectures, mentor our students, or engage in some way with our programs. So we really are focused on helping you get the career outcomes that you're looking for. So some of the areas that our students are really interested in and keen to have jobs are health consultancy. And of course, in London, there's the Big Four, PwC, Deloitte, KPMG, and EY. But there's also McKinsey, Boston Consulting Group. And I always remind students not to forget about small healthcare consultancies. They can be wonderful places to start your career, get lots of opportunities to interact. Usually in a smaller firm, you get a much wider kind of job role. Then there's management roles, things like big pharma, biotech, public-private organizations. Again, London has a huge health sector. Most of it's by the NHS. So of course, the NHS is a great place to get a job. There's insurance companies like Bupa, and other, NGOs, charitable organizations. So there's lots of opportunities for management roles and leadership roles. And then a big pharma sector. But last but not least is the health tech and med tech startup market, which is growing at an exponential rate here in the UK. So that's really, the heart of the program, the offer. But I also want to mention that at UCL, it's an incredible place to be a student. London's a fantastic place. And the extracurricular activities, there's the student union, there's lots of clubs and sports and societies, ways that you can really volunteer if you'd like. And also we have great student support. And at UCL East, where we're at in the Marshgate building on the second floor, there's a whole kind of place where you can go. There's people there every single day from about 9 to 4 who can answer your questions, give you advice, and the support that you need. So we are, as I've alluded to a few times, we're on this brand new campus. It is fantastic, and the building is amazing. So we're in the Marshgate building. Right across that bridge on the other side where you see the red is the student accommodations, and down on the first 3 floors are more classroom space. Up there on the left in the picture is the aquatic center. This was all the former Queen Elizabeth Olympic Park when the UK and London hosted the 2012 Olympics. So it's a beautiful setting. It's a wonderful place to be a student. There's other universities. The University of Arts has 4,000 students, just literally a stone throw from the UCL buildings. There's also about an 8-minute walk to the Westfields Mall, which is one of the largest shopping centers in all of Europe. So whether or not you want to do sports, also this is called the cultural quarter of the East Bank. So you have a Victoria and Albert Museum, you have Sadler's Wells, which is a theater, and you have lots of other kinds of destinations and things that are coming in. So it's a really vibrant part of London and a great place to be a student. And our building is amazing. The architecture, the study space, it's just fantastic for you. And then last but not least, just London moreover. The rest of London, Bloomsbury, which is the home of UCL, which is just a short ride on the Elizabeth line. The tourist attractions, of course, the theaters, the museums. So it's not surprising that London's constantly ranked as the top city in the, by students in the UK to study and learn. So that's really the end of my presentation. Of course, we've got lots of other events and ways in which you can engage and learn more about UCL. So what I want to do now is, before I go to the Q&A, I just want to introduce two of my colleagues who've joined me. They're students currently at the Global Business School for Health. So I've got Helen and Jingyi, who are with me, and I would just like to ask them a few questions to see whether or not they would like to talk about their experience. So Helen, why not tell us a little more about yourself and how you ended up coming to the Global Business School for Health? You're on mute. Can you unmute yourself?
Yeah, can you hear me?
Yes.
Yeah. So hi guys, I'm Helen. I'm from Hong Kong, and I have been a nurse for 9 years. I worked in the intensive care unit in a public hospital. And the reason why I chose GBSH is because I want to take a career break, and I see a great potential for my career advancement through this global healthcare leadership route masters, and that's why I've chosen this. And right now I enjoy a lot in my school life, because it's not just about GBSH. It's also about how you feel, how you live as UCL students, because currently I joined other clubs and societies as well.
Okay, so tell us about one of the clubs and societies you joined, Helen.
Right now I'm doing the rowing club.
Wow.
So like every week I have to go to the boathouse and I need to learn rowing. And it is also a great opportunity that I meet other students, like undergrads as well as postgrads. And we do a lot of like gatherings. And other than this, I was also joining the medical technology club, and I was currently learning about Python. It's some basic introductory courses, but I think it's really like meaningful, and it's very interesting for me.
Yeah, that's fantastic. And let me ask you, had you ever rowed before, or was this the first time you took up rowing?
No, it was my first time, and that's why I feel like being a UCL student is really having a competitive edge, because it's not just about academics. Like I got my own student life at here, and I seldom got a chance back in Hong Kong to do such activities.
Okay, that's great. And Jingyi, can you introduce yourself and tell us more about you?
Yes, of course. My name is Ji, and also you can call me Kelly. Um, I'm a new student for for a finance channel, actually, because before I attending class in digital health, but finally I found that maybe finance channel is more suitable for me. So during almost 1 month study, I find that in UCL, I think the course structure is really good compared to my previous study, because I can attend one lecture, then I can have time to do some seminar, can discuss with our TAs and also our teachers and our classmates. So I think it's really amazing for me to have chance to talk with different people.
Great. So what's your favorite course?
I think maybe for the risk management, because
Great.
yes, because I think every week I can learn different risks in healthcare industry. Because previously my major is accounting, I don't have too much experience and in this kind of industry. So in risk management, it can help me to know more about it.
And have you joined any clubs?
Not yet, actually.
Okay. So how do you spend your time then when you're not in class?
Well, because I don't have too much work experience before, so I'm so busy about seeking jobs.
Okay, great. So you're thinking of getting a job then?
Yeah.
That's wonderful. And Helen, what's your favorite course?
My favorite course is the strategic healthcare leadership, because right before I joined this virtual open day, I was actually discussing with my colleagues about our decision making, because tonight at 10 p.m. we have to do a round 2 decision making. Basically, this hospital simulation is something we need to do online. We have to form a group and we have to represent ourselves as a CEO, as a finance manager, bed manager, to like organize to run a hospital actually. And we got some fundings and we have to make different decisions to think about how to allocate the resources, for example, the manpower resources, the physical resources, as well as we need to think about the shareholders' opinions, how we can make a dividend, as well as maybe the infection rate. Like all of these things are actually correlated, and we have to make a very sound decision based on the evidence that we have made, as well as in previous round, how we did well or what we didn't do well in last round, to make a informed decision for round 2. And I think it's really exciting about that, because because I'm a nurse, like when I was working in the public hospital, I work as a frontline. And that's why I seldom got a chance to really think wide, like a more wider view on how a hospital actually runs. But for this simulation, I found it really interesting. It's because I am working as a role as a CEO. And that's why I could really see how things are actually allocated. And I like the dynamics between our team, because they are from different background. Some is from the business background and some is from a dentist. And that's why we got different mindset. And through our discussion, we have been like talking about 3 hours discussion last time in the school, until the school in Marsh Gate closed, that we need to leave and we to make the decision very fast. But I think the team dynamic is in general is very exciting, and I really like this.
Great, fantastic. Well, that's really helpful. And you also, Jingyi, I think you do some work on social media as well. Is that correct?
Yes.
So can you tell us a little bit about that experience?
Well, I think this job provides me a lot of opportunities to, to make some videos or also make some blog to introduce our GBSH, and also to share my life in the social media. And I think it's quite, good experience for me.
Well, I'm going to have to start following you. I can see you're going to be a big influencer.
Thank you.
All right. So look, I'm going to take some questions now. So we have one. Will we be able to do taster sessions of the 3 routes before deciding on one? That's a really good question, and we've discussed that. And I think we will be planning to have some route-specific events and opportunities for people to learn more about the routes, because we do see that as something that's really needed, because I think some students feel very torn about which route. And so, yeah, we will have some online sessions that can help you with that decision. And then will we be able to audit classes from other routes? Well, we haven't actually had any students come forward wanting to do that. It's not impossible. I think once you're in this program, you'll see the workload can keep you quite busy. So, you know, auditing may be something you think you might like, but you might not be able to find the time. But of course, if you requested that, we could explore that. Okay, is there any other questions? There's just those 2 questions. I'll just wait a few more minutes. If you've got a question, please don't be shy. Just ask the question. Put it in the chat. Okay. What can we, so they want to follow you, Jingyi. So how can they follow you?
Maybe you can just follow UCL GBSH and all of social media ambassador we post their their job in there.
Okay, great. Well, we'll have to get your brand up there as well. Okay, well, look, I don't see any other questions. I really appreciate Helen and Jingyi joining me today. And of course, if you have any other questions or you need anything, we're here to support you. So you can always email GBSH. I think we just put in the chat, the link to the Twitter at GBSH. So, if you got access to Twitter, definitely follow us. But again, thank you so much. And I look forward to seeing you again. Take care. Bye, guys.
Hi.
Bye.